Hi, welcome to my Population Health Management Intelligence series. I'm Siva Chandrasekaran, Population Health Intelligence Consultant, over 20 years of experience across NHS and local authority organization. Last few weeks, we looked at what is population health management, why is it important. We looked at the population health management cycle, and we looked at the three pillars: segmentation, risk stratification, and impact assessment, and finally the evaluation, as you may call it as the fourth pillar. And then we started our deep dive into segmentation. What is segmentation, why it's important, and different types of segmentation. This week, we're going to look at the approaches taken for segmentation. There are three different approaches for segmentation: expert driven segmentation, tool driven segmentation, and finally, data driven segmentation. Expert driven segmentation. This segmentation is done by experts, or generally clinicians, who understand their population, who understand the needs of the population based on service utilization. They understand what is doable and what is actionable, the logistics behind it, and they understand the money and the resources involved, what needs to happen in order to determine the segment. But they do have biases. The next is tool driven approach. Spanner? No, these actual tools. The tool driven approaches are generally deployed by companies like Bridges to Health, and NHS also have some free tools which can be found in National Data Commissioning Repository. These tools have derived segments, and you could fit your population into these segments. You can force them into these segments and analyze the data behind these segments. But these tools have their own drawbacks as well. Again, logistics, money, and resources need to be taken into consideration. However, these segments have proven case studies from other organizations, which is beneficial to determine. The last approach is the data-driven approach for segmentation. Again, this is purely based on data. There are lots of algorithms, machine learning algorithms like clustering and classification is done to do this sort of segmentation. Clustering, we look at data points, similar data points, get the midpoint. It's called k-means clustering method, machine learning algorithm method, and then understand the differences between those population and determine a segment. Next one is classification based on predefined segments. This is the information we already know, and try to identify any further details. For example, if you have a group with full-time retired population, what other further segmentations can we actually get? And that is classification for you. But again, the problem with these data sets, they are based on data in any given point in time, which means gentrification. People who live in council houses at one time might have moved out to different places. The council estates might now be business parks, or people from other geographies or regions come to this area. So that may have an impact. That oscillation in places may have an impact in terms of determining the segment. So, as a population health management expert, you need to understand all these three approaches, weigh the pros and cons of these approaches. Personally, all three of them are useful based on your needs of the population, your logistics, and your skill set of your team, and people, resources, money. You need to have an hybrid approach, considering all three of these approaches together and choose the one best suited to your needs. So, stay tuned in our population health management journey. Please remember to subscribe, like, share, and comment about this video. We will be sharing links to other videos and our playlists in the description below. And we'll be also sharing our sources where we got the information from. Remember, be happy, stay healthy. Thank you for listening.